Welcome to Module 9, Adaptation. Student learning objectives are to define the term adaptation as it relates to periodontal instrumentation, identify the leading, middle, and heel third of the working end of a sickle scaler and curette, using a typodont and an anterior sickle scaler, describe and demonstrate correct adaptation of the working end to the midline and line angle of the mandibular anterior tooth. Explain problems associated with incorrect adaptation during periodontal instrumentation. And using figure 12 in your textbook, you will use a pencil to demonstrate how to maintain adaptation to curved surfaces while using correct modified pin grasp and wrist motion activation. Given a universal curette and a typodont, explain how to use visual clues to select the correct working end for use on the distal surface of a mandibular premolar tooth. Use precise finger placement on the handle of a periodontal instrument while demonstrating adaptation and selection of the correct working end for a treatment area. First, let's define the word adaptation. The book's definition is the positioning of the first 1 to 2 millimeters of the working end's lateral surface in contact with the tooth. Adaptation simply means to adapt. So you're going to adapt to your surroundings. You're going to conform to your surroundings. This slide illustrates nicely the adaptation of an explorer against the facial surface of a central incisor. This slide illustrates the same tooth but with a sickle scaler. So there's just really no difference between the two instruments, except one is an assessment instrument and one is a calculus removal instrument. So the key to correct is understanding that the working end has 3 imaginary sections. It has the leading third, so that's 1/3. It has the middle third, there's 1/3. And it has the heel third, there's the other third. The leading third is the anterior portion of the working end, and in this case, the curette, the leading third is the toe third. So a curette has a toe, a rounded end. The leading third of a sickle scaler is also the anterior portion of the working end. The only difference is it's not a toe, it's a tip. It comes to a point. The correct adaptation of the working end to the tooth surface requires positioning the working end so that the leading 1/3 of the working end is always in contact with the tooth surface. If that leading 1/3 is not in contact with the tooth surface, then it's most likely in contact with the gingiva. Sometimes, however, it's possible that the leading 1/3 and the middle 1/3 of the working end, so here and here, can both be adapted to the tooth at the same time. So an example of this could be the facial or the lingual aspect of a molar, because that's a wider tooth. Pretty much when you go interproximally, you're always going to be on the toe or the tip. The heel, or the back 1/3 of the instrument, is never adapted to the tooth surface. We just don't have teeth that would be that wide or that flat where the heel of the instrument would ever have any adaptation to that tooth surface at all. This slide illustrates very nicely that the tip 1/3 of this sickle scaler is correctly adapted. As you can see here, the tip of the instrument is completely on that tooth surface. It is not touching the gingiva at all. Here's an example of incorrect adaptation. The tip third is not adapted. You can see it here, sticking out. And right now it's not touching the gingiva, but imagine as that instrument rounded into the proximal surface, the tip of that instrument would gouge or stick into the gingiva, and that would not be very comfortable. If you're following along in the textbook, this slide can be found on page 226. It's the bottom slide. And is this working in correctly adapted, yes or no? The answer would be no. In fact, it's actually the tip of it, the tip of the instrument is sticking out and would be what I would be called gouging the gingiva there on the side. So this is an incorrect technique. Next, this slide can be seen on the same page. Is this correct or incorrect? And the answer is that it's correct. The working in is correctly adapted. Note that the middle and heel thirds of the working in are not in contact with the tooth surface. It's just that tip 1/3. And again, correct or incorrect? The answer here would be correct. This is the correct way to adapt the working in to a line angle. Note that the middle and heel thirds of the working in on this particular slide are also not adapted to the tooth surface. And correct or incorrect here, that is incorrect. The incorrect adaptation is a mistake commonly made by beginning clinicians when moving from the facial surface onto the distal surface. So to review, adaptation is the positioning of the toe third or tip third of the working in against the tooth surface. And the purpose of this, not only for the purpose of calculus removal and detection, but also so that you don't hurt the patient. In summary, the correct adaptation of the toe or tip third to the tooth surface is essential for effective instrumentation. Correct adaptation of the working in prevents injury to the gingival tissue. This next section of the presentation is about selecting the working end of the instrument. So whenever you're using a double-ended instrument on a posterior tooth, you must decide which working end to use on that treatment area. And quite honestly, it's true of anterior teeth, anterior instruments as well. It's just a little bit easier to figure out. To select the correct working in, the clinician will observe the relationship of the lower shank to the distal surface of the tooth. The position of the lower shank provides a visual clue to the correct working end. It is helpful to use a premolar tooth for working in selection because a premolar is really easy to see versus a molar tooth. In these two slides, you can compare the two working ends. In the first slide, this photograph shows a working end of the instrument that's adapted to the distal surface of the mandibular premolar. So let me draw that here. This is adapted nicely. So now in the next slide, that's the same instrument, but it's flipped. It's the other end. And you can see that it's wrapping around the tooth instead of adapting to the side of the tooth. Also, you can tell that it's not adapted because the lower shank is not parallel to the distal surface. And this once again shows how the lower shank is parallel. So here's your tooth, and there's your lower shank. And then notice that the functional shank, which is this part, goes up and over the tooth. And as depicted in this slide, just like in two slides before, where you're using the wrong end of the working end, the lower shank, this is the lower shank right here, it is not parallel to the long axis of the tooth. It's actually more perpendicular. And the functional shank is down and around the tooth. So here's the functional shank. In summary, you will use your visual clues. So in other words, use your common sense to select the correct working end of a double-ended instrument for any treatment area. To select the correct working end, you'll observe the relationship of that lower shank to the distal surface of a tooth. This next part is case 1. We're going to evaluate the skills shown in the photographs. So in this case, we're going to name her Mary Beth. She has difficulties in instrumentation as a result of inattention to her large motor skills of clinician and patient positioning. So remember we talked about our large motor skills, that's sitting back on your chair and keeping your body in a neutral position. She is also tilting her head down and leaning over the patient. The wrist of her dominant hand is bent as well. She should release her position of her fulcrum and reestablish a neutral wrist position. Regarding adaptation, Mary Beth is adapting the middle third of the working end to the tooth, as seen here. This incorrect adaptation technique could result in the inability to remove calculus deposits and tissue laceration. With this last slide actually showing a close-up picture of her inability to adapt that tip 1/3 to the tooth. As you can see, it's lacerating the gingival tissue there. Case 2, as indicated here, the patient is positioned too high in relationship to the clinician, as you can see, because she's having to lift her arm way up to be over the patient. This incorrect positioning is causing her to hold her arms up in order to access the treatment area and probably will result in some aches and pains. She's sitting on the side of the edge of the seat too and leaning towards the patient. She's using the correct end of the Explorer, and the working end does tend to appear to be correctly adapted. Here she's using the correct end of the Explorer and has the tip third adapted to the tooth as well. So that concludes Module 9. Thanks for listening.